Carbohydrate foods are those that are made up of either starches or sugars, and they include things like bread and cereal, rice and pasta, other grains such as couscous or quinoa. Also includes things like fruit and fruit juice, starchy vegetables such as potato, sweet potato, corn, milk and yogurt. Legumes such as lentils, chickpeas, baked beans, or anything that's made from sugar or flour are carbohydrate foods. When we eat carbohydrate foods, whether it's a starchy food like bread or whether it's a sugary food like lollies, they're all broken down into glucose and released into the bloodstream. And this is what our body needs for energy, especially our brain. We need some carbohydrates for fuel and for our brain to function properly. Carbohydrate foods are broken down into glucose and released into the bloodstream. The rate at which this occurs is called the glycaemic index or the GI. So foods with a high GI are broken down quite quickly, and they tend to give a bit more of a bigger or sharper rise in blood glucose levels. So examples include white bread, most sugary foods like lollies or soft drinks. Other examples include your regular white potato or even some fruits like watermelon as well. Foods with a lower GI tend to be broken down a bit more slowly and tend to give a bit more of a steadier and slower rise in blood glucose levels. Examples include multigrain bread or high fibre cereals like porridge or natural muesli. Also includes sweet potato, most types of pasta, and also things like basmati rice and legumes as well. Because the low GI foods are broken down much more slowly, they also tend to keep us feeling fuller for longer as well. Although most low GI foods are generally the healthier options, they're usually higher in fibre and have more nutrients such as multigrain bread and oats or porridge. They're not always the healthiest choices. Some low GI foods are still really high in saturated fat and high in sugar. So, for example, chocolate and ice cream are low GI foods, but these are foods which really should just be limited to special occasions and not eaten on a daily basis. On the other hand, some high GI foods are actually still really healthy choices. As I mentioned before, your regular white potatoes and watermelon are high GI foods, but these are still fruits and vegetables. They contain, vitamins and minerals and are still high in fibre, so these are still quite suitable choices to be having on a daily basis. What really is important when it comes to blood glucose management is the amount of carbohydrate that we're consuming rather than the type. So even if you were to have a really large portion of a low GI food, you would still have high blood glucose levels because at the end of the day, you've still consumed a large amount of carbohydrate. The same goes for high GI carbohydrates. If you consume them in small amounts, they're not going to affect blood glucose levels too much. So it's more about the amount of carbohydrate that we consume rather than the GI.